Good morning, and at the outset, let me thank everyone at BronxWorks both for hosting us this morning and also for partnering with us on the work that we're focusing on today. I would blame them for the rain, but it's been raining far away from here, and I'm going up to Boston where I'm told it's raining as well. For those of you that are worried about the rain, the record, I'm told, is 40 days and 40 nights, so it will eventually stop. We are about to present preliminary research findings on our pilot conditional cash transfer program, the first of its kind in the nation. We call it Opportunity NYC Family Rewards. It began 3 years ago in an effort to answer one fundamental question. How can a government empower more people to break out of the cycle of poverty and become self-sufficient? Clearly, doing more of the same wasn't the right answer. The federal government has been fighting poverty with the same basic weapons for decades, and we weren't going to wait for them to develop new, innovative approaches. What they were doing helped some, but obviously not all, and it's time to take a new look at it. So we took the initiative and began looking at poverty with fresh eyes, and we decided that it was worth finding out if conditional cash transfers, or CCTs, as we call them, which incidentally have proven very successful in Mexico, Turkey, Brazil, and other nations. We wanted to find out whether they would work in New York City as well. CCTs start with the premise that the stresses of poverty often cause people to make hard choices that aren't always in their best long-term interest. For example, they may put off doctor's visits to save money, but such neglect may then lead to debilitating and financially crushing illnesses. Or workers may pass up job training classes because of upfront costs and then find themselves in a treadmill of low-wage, short-term jobs. But we thought, what if people get cash grants for making decisions that improve their long-term health and well-being? Now, we know such initiatives work for middle-class people. The mortgage interest deduction on the income tax certainly encourages home ownership. We know that bonuses can encourage better performance in the workplace. And there's also evidence that CCTs have improved preventive health, school attendance, and other poverty-relieving investments in human capital in the nations that I just mentioned. Would something similar work for financially struggling New Yorkers as well? That was the question. To find out, our Center for Economic Opportunity launched Opportunity NYC Family Rewards on a 3-year pilot basis in 2007 in 6 neighborhoods with high poverty. We enlisted the help of BronxWorks and other social service organizations with strong records of making a difference in the lives of people in their communities. And because this was an untested idea, we chose not to use taxpayers' dollars for it. Instead, it's been supported by funds from philanthropic sources, including the Rockefeller Foundation, which is represented here today by its Associate Director, Margot Brandenburg. Thank you very much. Donations were made to the Mayor's Fund to advance New York City. We also designed the program to include a rigorous evaluation of results. The 4,800 families involved in it were evenly divided between those receiving program incentives and a control group that did not. And then we asked one of the nation's most respected organizations in the area of social policy research to evaluate Opportunity NYC Family Rewards. We wanted to get some real hard data as to whether it's working, not just what we assumed was going to happen, but what actually happened. And today they're presenting their findings on the first 2 years of the program. We've learned a lot in those 2 years about what worked and what didn't. What worked was exciting, and what didn't work was just as important. Over 2 years, we saw some families get a firmer grip on financial stability. We saw some children make significant progress in school, and we saw some New Yorkers create better futures for themselves. But we also saw some things that didn't work. The program on the whole did produce some highly encouraging results. But it is not the be-all and end-all, and it doesn't work in every single case, and the responsibility that we have is to try to tune the program, devote the resources to things that are working, and you have to take them away from the things that don't. Unfortunately, government seldom does that, which is why costs keep going up, and we don't keep improving the results. The answers that have emerged from this program are going to influence discussions on how long-term solutions can be adapted to fight poverty from now on. So without further ado, let me turn the floor over to the president of MDRC, Gordon Berlin. Gordon? Thank you.
Thank you, Mayor Bloomberg. So Family Rewards had two key goals. The first was to reduce material hardship and poverty in the short run, and the second was to reduce the intergenerational transfer of poverty in the long run. It aims to reduce current poverty through direct cash payments to families with children, but with an eye to the longer term, it conditions those payments on improvements in children's education, families' preventive health care practices, and parents' work efforts. In this way, it seeks to help families become more self-sufficient and break the cycle of intergenerational poverty. So this is a key moment in social welfare policy. The deepest recession in 70 years has put strains on the social welfare system, and the nation is looking for new approaches. Conditional cash transfers have proven effective in developing countries. Can they be adapted to the problems in developed countries? To obtain a reliable evidence on that question, we employed a random assignment research design to measure the net difference this program is making. In short, we're holding Family Rewards to the same high standard that the FDA would hold a new medicine or a new prescription drug to. And the data I'm going to report on right now covers the first 1 to 2 years, depending on the data source that we have. So the first question is, do we really have a good test? Incentives can only work if people know about them, understand them, and have the wherewithal to act on them. Family Rewards had to engage 2,400 families, get them to an orientation, explain the incentives, explain what they had to do to document that they had achieved each of the objectives, and then develop a system to collect and confirm and make timely payments. The executive summary that you have in your packets include the list of incentivized activities that were part of the program. These included things like school attendance, passing a regents exam, getting a health checkup, and parents' full-time work. So while there was I'd say a 6 to 9 month learning curve, program operators, as well as for both the program operators and families over time, CETCO and the community organizations like BronxWorks did succeed in reaching virtually everyone. 98% of all program eligibles received some payment, 65% got a payment every single pay period, and the average family earned $3,000 per year. So Family Rewards did, in fact, succeed in actively engaging all of the families, and I'd say that we do have a fair test of the program. Turning now to the results, I want to begin with the first goal, reducing poverty and material hardship, arguably a prerequisite for the longer-term intergenerational poverty effects that we're concerned about in this project. Now note that random assignment, that process creates two groups that are similar in every way but one. The program group is eligible for the new program, in this case Family Rewards, but the control group is not. The control group tells us what would have happened without the program. It's the benchmark against which we're going to be comparing the program results, and that's what makes this such a high bar. So let's take a simple example, looking at the fraction of people in each group that had a bank account. Arguably the first step in this kind of process towards self-sufficiency. As you can see, the program group represented by the yellow bar, 73% of the people had a bank account when we interviewed them in the 18-month period, but only about 51 or 52% of the control group had a bank account. That's a difference between the two of about 21 to 22 percentage points. And it's that net difference that's the value added of this program. Without a control group, we wouldn't be taking this thing that the program had created the 73% effect. Notice also the 3 stars. Notice also the 3 stars. That means the results were statistically significant. And that's essentially telling us that the program, that the difference that we're seeing between the two groups is a difference that did not occur by chance. And if you look at the other bars on the slide, they show that Family Rewards had a range of positive effects. They were less likely to say they were food insufficient, that is, they had enough food to eat. They were less likely to say they could not make ends meet. They were less likely to use a check casher, which meant they had more income. It's not up there, but they also had more savings. Family Rewards increased families' incomes by about 25%. And that 25% increase led in turn to an 11 percentage point decrease in the likelihood that a family would be in poverty as a result of this program. So, as we'll see later, although the program transferred large amounts of money to families, it did so without causing an offsetting reduction in work effort, a problem which has plagued many other income transfer programs. It's another one of the things that makes these results particularly interesting. One of the biggest questions, of course, is whether family rewards improve children's school performance. And here the story varies by level of schooling and type of student. For elementary and middle school students, we've not yet seen any effects on attendance or standardized test scores. In the slide you can see there are no differences between the two groups. On average, attendance rates were already relatively high, about 90% for the elementary school children, so there just wasn't much room to make a difference there. However, there is one intriguing result for this age group. Elementary and middle school children were more likely to take part in programs that would help them with their schoolwork and their homework, even though there were no specific incentives attached to that set of activities, and this may be an indicator of greater parental engagement as they made efforts to try to equip their children to do better on tests, etc., as a result of the program. Now, for the analysis of high school students, we divided the 9th grade sample into two groups. Those who did not score at proficiency levels when they were back in the 8th grade and thus might be a little bit less prepared to enter high school, and those who did score at proficiency levels. As you can see on the group of bars on the left, family rewards had no effects on the less proficient group, which may mean that they were just too far behind to earn some of the education rewards and really needed a more direct set of educational intervention. But in contrast, the program had substantial effects on the more proficient group, represented by the bars on the right. Typically, many proficient students do struggle in high school and do fail to graduate. So after 2 years, we can see that family rewards cause such students to perform better than they otherwise would have on a range of critical outcomes. They had better attendance, 15 percentage points more likely to achieve our 95% attendance standard. They were less likely to repeat a grade. They were more likely to accumulate the 11 credits per year that would put them on track for high school graduation, and they were more likely to pass at least 2 Regents exams. If this progress were to continue, the program would be a long way towards achieving its second goal on the intergenerational transfer of poverty. Now, the next slide shows effects on a range of health-related outcomes among parents. Perhaps most surprising was the extent to which the control group had insurance coverage, the bar on the left there. Nearly all of them did, which reflects the progress made over the last few years by the city and state in facilitating access to the public health benefits that are available. But it does mean there was less room for family rewards to actually make a difference there. Note, however, that there were small improvements across a range of health-related outcomes, including sustaining insurance coverage, reducing reliance on emergency rooms for routine care, and that's a finding that it doesn't take a big effect before it starts to save money, and a quite large effect on dental care. And these effects on emergency rooms and dental care were somewhat larger for high school students. So the last slide shows effects on parents' employment outcomes. And here we looked at 2 different data sources: a broader measure of employment based on participant answers on a survey, in which we collected a detailed work history, and a narrower measure based on employer-reported information about jobs covered by the unemployment insurance system. That system doesn't include self-employment, it doesn't include federal employment, it doesn't include contract work, and that's why we say it's a somewhat narrower measure. Looking at the broader measure first, the second bar in the chart, more people in the program group than the control group reported that they were working full-time, about a 6 percentage point difference. And that aligns with the way the program's work incentives were designed. Looking at the narrower employer-reported data, we see that the program group was slightly less likely to have worked during the first year. So it appears that there was an overall increase in work, but also that some people who would have worked in UI-covered jobs instead took jobs not covered by UI or did informal work. So in conclusion, family rewards is well along in achieving its prerequisite goal, reduction of poverty and improvements in economic well-being, and it has begun to see gains in education and health that could help it achieve its second goal if those continue to grow over time. It's important also to remember that these results, especially the employment results, were obtained during the most difficult economic climate in the last 70 years. So the key question again is whether these effects will grow over time. In addition, as the mayor said, we've learned some key lessons about targeting and program design to inform a next generation test of CCTs. There are several cities, a number of developing countries that are interested in this effort because it's really explored some new areas like achievement and employment. And we believe these lessons will also be informative when the national government begins about a year from now to rethink the design of the social welfare safety net. Thank you.
Gordon, thank you. Research findings have already guided the direction of Opportunity NYC Family Rewards, and as the program entered its third year last September, you should know that we did discontinue some elements, such as incentives for elementary and middle school attendance, because the bottom line is that research showed that they just weren't having an impact. We're going to have to find some other ways to get middle school and elementary school kids to go to school, but this program didn't seem to make any difference. Other parts of Opportunity NYC Family Rewards, however, has helped some families make encouraging progress in education, health care, employment, and in lifting themselves out of poverty. And one such family is with us today, and I would like to ask the mother of the family, Marley Lexis Guillen, to speak about her experiences with Opportunity NYC Family Rewards. Venga aquí.
Ok, mi nombre es Marley Lexis Guillen. Yo soy parte de Opportunity New York.
My name is Marley Lexis Guillen, and I'm part of Opportunity NYC.
Bueno, este programa para mí fue bien importante porque a pesar de que estaba en el programa antes, tuve unos cuantos problemas porque era una familia que era de asistencia pública.
This program has helped me a lot. Before this program, I was on public assistance, so it has helped me a lot.
Okay. Después del programa, yo comencé a estudiar y a trabajar. Yo voy a Hostel Community College.
After the program, I enrolled in Hostel Community College, and I started working as well.
Y estoy agradecida con este programa, gracias a Bloomberg por eso, y gracias a ustedes por ayudarme a estar en este programa.
And I'm very thankful for the program and for Mr. Mayor Bloomberg and to be part of this program.
Y después, cuando termine el programa, que da pena que termine, voy a trabajar más, a estudiar más, gracias al programa.
After the program ends, I'm going to start working more hours and to continue with my studies.
Gracias.
Thank you so much.
Ella tiene dos hijas aquí. ¿Cómo se llama? Más fuerte. Michelle? Richelle and Mariela? Well, Mariela. Bienvenidos. It is also a pleasure to introduce the Executive Director of BronxWorks, Carolyn McLaughlin. Carolyn.
So I'd like to congratulate and thank Mrs. Guillen, who is one of the 800 families that we recruited for the program and one of 400 who was actually in the program and not in the control group. So we congratulate you on your success, and we look forward to continue working with you. BronxWorks is a settlement house in the Bronx that serves approximately 35 families a year. And we're very, very pleased to partner with the city on this and actually 4 other CEO projects. This is the first one that has results from it, and we're, really congratulate the city in doing a control group and the full study of the outcomes of the programs, because we do care and we all want our programs to be as effective as possible. We work with the city on many programs that are really anti-poverty programs and consider ourselves an anti-poverty agency. I know Manpower recently had a study out on other types of programs that are effective in reducing poverty, and some of, I think, our programs relieve poverty and some really reduce poverty. We all know that the South Bronx is one of the poorest areas in the country. We run early childhood education programs, and that has an effect of reducing poverty. We work on reducing street homelessness and have had a lot of success in reducing street homelessness in the Bronx, preventing families from becoming homeless sheltering families, running alternative small high schools, which is another one of the city's initiatives, including a transfer school that helps, like a second chance school for students that otherwise wouldn't graduate from college. We place each year about 600 people in jobs, most of whom are on public assistance. So we applaud the city in taking care, and the mayor particularly, of and caring so much about what happens to low-income residents in the city and in the South Bronx. And we look forward to hearing the results on the other CEO projects as they become available. And we also look forward to continuing, many of the social service programs that help people in the Bronx and other poor areas in the city. Thank you.
Carolyn, thank you. Opportunity NYC Family Rewards will continue through August of this year, and MDRC's evaluation of the program will go well beyond that, and that will inform any future versions of the program that may be developed. And we'll share our findings widely with other cities, with federal agencies, and with all those on the front lines of helping our people realize the American dream. And before I take a few questions, let me just summarize today's announcement en español. Estamos anunciando los primeros resultados de nuestro programa piloto llamado Oportunidad NYC, creado para ayudar a los neoyorquinos con escasos recursos romper el cielo de pobreza. Algunas familias han demostrado progreso alentador.